Unverferth. I am the director of the UCLA Women's Life Center. I'm the medical director of our maternal mental health program, which comprises, it just has a perinatal IOP, and then I have a private practice in Santa Monica. I gave a presentation on advances in postpartum depression treatment. Some of the things I highlight that I think are really important for people to know is that postpartum depression is often a very anxious depression. So people tend to have circular thoughts, ruminative thoughts, intrusive thoughts are really common in postpartum depression. So we see that nearly 100% of people have intrusive thoughts of accidental harm coming to their infant, and about 50% have thoughts of intentionally harming their infant, which can be so distressing. It also has like the more traditional depression symptoms associated with it as well. We know that postpartum depression is one of the biggest risk factors for postpartum suicide, and so I always think that's so important to highlight because treating postpartum depression can save lives, really. Things that I highlighted was sort of the etiology of postpartum depression. So we think that there's this GABA glutamate dysregulation in postpartum depression that's driven by the hormonal changes that occur in pregnancy and in the early postpartum. What we know is that there are newer postpartum depression drugs like the neuroactive steroids, of which Zuranolone is one, that really target this GABA glutamate dysregulation and sort of seem to help right this imbalance that comes up. I also talked about some emerging treatments for postpartum depression, like TMS has fairly good evidence. Ketamine, S-ketamine, I think the data is still developing, but there are some interesting studies coming out that show that S-ketamine infusions given directly after childbirth for people who have mild depression symptoms might prevent depression. So maybe we'll see some more research there. And then I also talked about some a novel psychedelic called Luvacilin, I think is how they're saying it, from Reunion Neurosciences that is a one-time infusion to treat postpartum depression that just had some really promising phase 2 clinical data, and we'll see what happens in phase 3. Yeah, I think when assessing PPD, one of the things that I think is most important to screen for is birth trauma. Incidentally, like we know that birth trauma is fairly common, and often it really matters more like what the person's experience was of birth rather than what actually happened, right? We know that when people experience feeling out of control or dissociating, or if they have complications, of course, that increases the risk of birth trauma, and we know that birth trauma is a big risk factor for postpartum depression. So I think screening for that is really helpful. I also think screening for intrusive thoughts can be really like life-changing for people. So, right, if you've been around psychiatry or in therapy before, you probably know what an intrusive thought is, but we know that a lot of women have their really first contact with psychiatry in the postpartum. Intrusive thoughts during that time can be really stressful, right? So I've had women come to me who think that they're like losing their mind, that they're becoming psychotic just from intrusive thoughts, right? Because intrusive thoughts can be very vivid of like intentionally harming your infant, right? It could be a thought that pops into your mind. And I think reassuring them that this doesn't mean that they're going to harm their infant. In fact, studies show they're less likely to harm their infant, can really change their life. I think for research and treatment, I mean, I'm so really excited. I talked a little bit about sort of this newer study that is like working to identify a biomarker for postpartum depression. So in the future, maybe we will actually have a blood test that identifies women in the third trimester who are going to go on to develop PPD. I think that's really interesting and exciting. I think the new class of medications to treat PPD, the neuroactive steroids, are so exciting. Zuranolone is a 14-day treatment that's FDA indicated for PPD, and so I think that's really like changing the field of postpartum depression treatment. I mean, I think the thing that's most indicative of postpartum depression is the timing, right? If someone's having a tough time in the postpartum, the Edinburgh Postnatal Depression Scale, like EPDS, can be really helpful to use to screen someone for postpartum depression. I think symptoms that would really point to PPD would be feelings of like sadness, tearfulness, overwhelm, mood swings. Any suicidal thoughts would really tip you over. Sometimes there are energy changes, sleep changes. If someone can't sleep when the infant's sleeping, that's often a really big red flag, especially if it's due to anxiety or circular thinking, because often you're so tired, you kind of fall asleep really quickly.